Great. So, welcome, Stephen. Very excited about your workshop and conference for the BABCP conference in Manchester this year. Um, the conference theme this year is catalyzing change, ideas to impact. And you're going to be speaking at the conference on working with complexity and
Right.
understanding complexity. Could you just say a bit about how your workshop and keynote relate to the theme of the conference?
Yeah, absolutely. I mean, there's lots of good reasons for going to Manchester. It's a very vibrant city and conference is always worth going to, but I particularly like the theme. I think it's because the whole idea of being a catalyst just sits well with me. I'm really a therapist first, and a supervisor, trainer, researcher, second, third, fourth. So I see my clinical work as sort of core, really.
Mm.
And I think I hope I'm a catalyst for my patients, but I see the therapy very much as theirs, and it's theirs to own. They are the agents of change. We stimulate things if we can. So I particularly like that relationship. I quite like the idea of being a Sherpa as well, the idea that you accompany someone on their journey and catalyze it in some way. So I love that.
That's great.
And also the whole idea of ideas from impact, it seems to me one of the strengths we have in CBT as a field is there is an openness to new ideas, but also because we know the impact of thoughts, we know how harmful bad thoughts and unhelpful thinking can be, and
Indeed.
we know how beneficial productive thoughts, helpful thought patterns can be. So the conference is a place where ideas get exchanged, where there's an openness to new ideas, and actually ideas are given a run for their money, because from ideas to impact, actually we really do take seriously what is the impact of what we're doing. There's a scientific base there. And I honestly, genuinely, over the last 20, 25 years, I think more than anything else, going to conferences made the biggest difference to my development as a
Indeed.
therapist. Never mind
Fantastic.
the trainer, blah, blah, but as a
Mm.
therapist, really. So
That's brilliant. Yeah, thank
that's my
you.
pitch.
Yes, great. And could you say something? You'll be speaking about complexity at the
Yeah.
conference. Can you tell us a little bit about your take on what makes for a complex case?
Yeah, so we were talking about this a bit earlier. I think we
Mm.
share a kind of view that it's really important, isn't it, in the field for us to acknowledge that some of the work we do is quite complicated, can be quite challenging, particularly for younger therapists, still cutting their teeth, still learning their trade. So for me, complexity is real and it's important, but we've not yet formulated all the ideas we need about it in CBT. We've not taken them through to impact. So for me, it's one of those constructs that needs to be talked about. So I hope my talk will contribute to that. But my key point, as it were, is that I think we're part of the complex case. I think when we talk about, oh, I'm working with a complex case at the moment, we tend to think, well, there's this client or patient with these difficulties in this history and they are complex. And I'm going to suggest that's potentially misleading. What might be more productive, more helpful is to say, oh, I'm working in a complex case at the moment. I'm in the case.
Yes.
The case is my patient, it's myself, it's the service, it's the context. And there are complications in our work together that make what I'm doing a complex case. And I'm trying to understand what they are and simplify them and overcome them, which seems to me a more dynamic and hopeful way of approaching complexity, which is not denying it, but it's trying to make it a more dynamic concept that's based more about treatment and whether treatment is complicated or smooth, really. So if you come to Manchester, I will be trying to persuade you, at very least, to take some of these thoughts on board and try them out and see if they
That
help
sounds
you.
fantastic. Yes, thank you, Stephen. It's something I can really relate to as clinical lead of a talking therapist service, and I'm sure this is a theme and a topic that's going to be of great interest to the kind of therapists and conference delegates. So yeah, really looking forward to it, and I will see you there.
See you there.
Thank you.
Cheers.